Assalamualaikum and greetings to all. My name is Yasmin Shakina binti Muhammad Isuf, and today we are going to be sharing with you on our research topic, which is coping with mental health among cycling athletes in Terengganu during COVID-19 pandemic for the conference, International Conference on Communication, Management and Humanities, Iccomah Iii 2022. Without further ado, let's begin with the introduction. The Malaysian government has implemented a restriction of movement order as a preventative strategy in order to halt its spread. Nonetheless, of the implemented strategies, the pandemic has had a tremendous impact on many different aspects of societies, according to World Health Organization 2020. In particular, the COVID-19 pandemic outbreak has caused the greatest disruptions to the world sports calendar. Athletes' training schedules were jeopardized when competitive sports calendars were abruptly cancelled, stated Bertolo et al. 2021. Athletes who are just unable to continue their usual training were negatively affected by this situation, stated Messafar et al. 2020. The World Health Organization defines mental health as a condition of well-being in which each individual fulfills his or her potential, can cope with typical stresses of life, work successfully and fruitfully, and contribute to his or her community, stated Parcher et al. 2021. During the COVID-19 pandemic, some athletes suffered from mental health issues due to the isolation. Athletes' mental health is a key factor in their ability to perform well, according to Al-Mataraji 2021. It is advised that professional athletes' mental health should be closely monitored during this pandemic. Such issues of, for example, Malaysia high jumper athletes Lee Hup Wei, who had seemed to be facing psychological obstacles, according to New Straits Times Malaysia Rajan 2021, stated that Lee Hup Wei, who needed to be qualified for the Olympics, struggled to hit his form, and stated that he became anxious about the scenario, and in order to stay sharp, he needed to join competitions. But however, due to the COVID-19 pandemic, many events had been cancelled. He further stated that he had been meeting sports psychologists to help him overcome with his mental health. Moreover, in Italy, Bertolo et al. Stated that Italian cyclists were confined in their home for 55 days due to the COVID-19 pandemic. Lack of interactions and communications with partner or teams was taking a toll on the cyclists. Some cyclists admitted that they had difficulties with keeping up their training routine, stated Morbi et al. 2021. In Terengganu, through preliminary research, according to Majlis Sultan Negeri Terengganu cycling coach Suryani binti Muhammad, the difficulties faced by the cycling athletes in Terengganu was the long hours duration in training indoors, which may affect the athletes emotionally, and it could affect the athletes' performance. And according to Al-Mataraji et al. 2021, the various sources of stress and anxiety will have to be dealt by athletes during this COVID-19 pandemic. And athletes are just as vulnerable to the general population to the negative psychological consequences of COVID-19 pandemic, such as stress, anxiety, and depression, Messafar et al. Moving on to the problem statement, the first one, which is COVID-19 restriction made it difficult for athletes to perform. According to Bertolo et al. 2021, COVID-19 restrictions have made it difficult for athletes to perform, as cyclists were banned from leaving their homes, and therefore it is difficult for them to perform their ordinary training. Al-Mataraji et al. 2021 presented that athletes are unable to avoid this epidemic ongoing evolution, tight isolation measures, as well as the closure of training fields and sports spaces, which are causing athletes' competitive rhythm and training routine to be severely disrupted. In addition, Morbi et al. 2021 mentioned that lack of physical activity can disrupt mental health as COVID-19 pandemic has heavily impacted the athletes' routine. And according to Suryani binti Muhammad, the coach of Majlis Sukan Negeri Terengganu Cycling Athletes, the long hours duration may affect the athletes' mental health. These are the main problems that have been identified in this study regarding coping with mental health among cycling athletes. This issue, however, exists among Terengganu cycling athletes. Thus, the purpose of this study was to look into mental health of Terengganu cycling athletes, including the prevalence of depression, stress, and anxiety, as well as the coping strategies among cycling athletes in Terengganu during COVID-19 pandemic. Moving on to the research questions and research objectives. The research objectives for this study is to determine the mental health level of cycling athletes in Terengganu during COVID-19 pandemic. The next one is to identify coping strategies among cycling athletes in Terengganu during COVID-19 pandemic. The last one is to determine the relationship between coping strategies and mental health of cycling athletes in Terengganu. Whereas for the research questions, the first one is what is the level of mental health among cycling athletes in Terengganu during COVID-19 pandemic? The second one, which is what is the coping strategies among cycling athletes in Terengganu during COVID-19 pandemic? Lastly is what is the relationship between coping strategies and mental health of cycling athletes in Terengganu? Moving to the literature review. Here are a few of the literature review that are closely related to my studies. And methodology for the research design, I have used quantitative design with non-experimental method and using a survey method for the questionnaire. As for the sample, it was purposive sampling, which includes 86 respondents from cycling athletes of Majlis Sukan Negeri Terengganu. For the data collection, we had approached the athletes by distributing the questionnaire through online platform, and the questionnaire was created in Google Form. As for the data analysis that was used was descriptive statistic and also Pearson correlation. And as for instrument, a dot questionnaire was from Athletic Coping Skills Inventory, ACSI, and also Depression, Anxiety and Stress Scale, DAS-21. Moving on to the analyzed result, this was the result for demographic profile, gender, age, and categories of athletes. The gender respondent for males were 45 respondents, which are slightly higher than the females, who were with 41 respondents. For the age categories, the highest respondents were from between 22 to 24 years old, and as for the least respondents were aged from 14 to 17 years old. And as for categories of athletes, most respondents were from the categories of road bicycle racing categories with 37 respondents, followed by the track cycling and mountain bike with 17 respondents from each category, and BMX category consisted of the BMX category responded of 15 respondents. The first objective, which was to determine the mental health level of cycling athletes in Terengganu during the COVID-19 pandemic, the outcome variable of stress and anxiety and depression were operationalized by using the depression's anxiety and stress scale. This subscale consists of 3 categories, which was DAS-D, DAS-A, and DAS-S for measuring. The score varies from normal, mild, moderate, severe, and extremely severe. From the result, depression was scored from normal to severe, anxiety was scored to severe, and stress was scored to normal. Moving on to the next second objective, which was to identify coping strategies among cycling athletes in Terengganu during COVID-19 pandemic. It consisted of 7 subscales, For subscale number 1, most of the respondents answered often. As for subscale second one, most of the respondents answered from often to almost always. As for the third subscale, most of the respondents also answered from often to always. As for the fourth subscale, most of the respondents answered often. Subscale 5 was answered as often to almost always. And subscale 6, most respondents answered from sometimes to often. And for subscale 7, most respondents answered often. Okay, moving on to the third objective, which is to determine the relationship between mental health and coping strategies of cycling athletes in Terengganu. The result of correlation is R value of 0.507 showed that the relationship between mental health and coping strategies are positive. The correlation was moderate, referred to by Cohen 1988, and the relationship between mental health and coping strategies of cycling athletes in Terengganu shows that there was a significant relationship between mental health and also coping strategies towards the cycling athletes in Terengganu. Moving on to the discussion, based on the research objectives and research questions, two methods of analysis were used, which were descriptive and also Pearson correlation. The outcome for overall variables of depression, anxiety, and stress indicated that the respondent had leaned more towards the normal to mild level for their mental health, with a mean of 2.23, while for the outcome variables of coping strategies indicated that the respondent had scored more towards the often with a mean of 3.05, which means that the respondents can cope and utilize the coping strategies well. Moreover, as for the relationship between the mental health and coping strategies for athletes in Terengganu, the result showed that the correlation R value 0.507, which indicates that the relationship between mental health and coping strategies are positive. Overall, it is found that coping strategies can help the individual to cope with mental health during COVID-19 pandemic. As a conclusion, the COVID-19 pandemic has created an emergency outbreak and has gone into a statewide lockdown. This contagious virus not only raised concern over everybody's health, but also caused psychological and mental disorders among athletes. In this research, it can be concluded that the COVID-19 pandemic can affect the athlete's mental health. Therefore, during the crisis, it is vital to identify coping strategies with appropriate psychological strategies, techniques, and interventions for the population of mental health to be preserved and improved.
And that is all from us. Thank you very much.